We'll call this to order. For determination of quorum, we'll do the same roll call that we'll do for votes. Jeff Butler.
Aye.
John Lebo.
Aye.
Bob Coddington.
Aye.
Paul Ryder.
Aye.
Sabrina Pennington.
Aye.
John Eagleman.
Aye.
And Pete Zaleski. That's an aye. All right, so we're all there. I had to write them down so I'd remember everybody that I need to call. Sorry about that. Okay, first order of business, we have the minutes. Should have been emailed to everybody.
I'll make a motion to approve the minutes as presented.
Bob Coddington made the motion to approve.
Second, Eagleman.
John Eagleman made the second to approve the minutes. Any further discussion? Hearing none, we'll do a roll call vote as before. Jeff Butler.
Aye.
John Lebo.
Aye.
Bob Coddington.
Aye.
Paul Ryder.
Aye.
Sabrina Pennington.
Aye.
John Eagleman.
Aye.
Pete Zaleski. Aye. All righty. Health officer report. Let's see.
Dr. Jetmore, do you want to go over the coronavirus updates?
Yeah, Wayne County up to date has 78 total cases of, let me rephrase that, they have 36 confirmed cases, that is cases that are proven by testing, and 42 clinical cases, that is people who exhibit all the signs of coronavirus but have not been confirmed with testing, which is a total number of 78 cases. The state, as of Wednesday, had done 94,000, almost 95,000 cases. The 1,007 Hoosiers have died of COVID, which is an increase of 43 over the previous day. Another 107 probable deaths have been reported. Those are deaths where people died and COVID-19 was listed as a contributing cause based on x-rays and other clinical symptoms, but no positive test was on record. So that's where we're at present. If you look at the daily cases at the hospital, it looks like, the curve has risen up and it's kind of leveled off, but it hasn't really fallen off the side. We haven't seen kind of a reassuring daily decrease in cases, which we would like to see. The CDC and the WHO have talked about having 14 days of decreased cases as one of the 4 criteria for really opening up society completely as it was before the virus. So we certainly haven't triggered that metric as of yet. But that's basically where we're at present.
Dr. Chatmore, John Lebo, are we still at 3 deaths?
Yes, we've had 3 deaths, and they were all in that elderly age group, which is the most, with comorbidities, which is the group that actually, if you look at the state statistics, 87% of the deaths have occurred in people 60 years old and older. And they go up dramatically in the 7th, 8th, and of course 9th decade of life.
This is Bob Coddington. How many have been tested in Wayne County officially?
I don't know. Do you have that number, Christine?
I can get it pretty quickly. It's over 300, which brings us to the next thing that we're going to talk about.
Right. Now, I've got a question. If we were so limited in our testing, and you almost had to be in the wheelhouse to be tested at 300, and only 36 people out of 300 being tested have, that's like a 12% hit rate, and you have to be, what, over 60 and, coming in with all the symptoms. Is there any explanation for that? I would have thought it was 80% if we're targeting who we're testing.
Dr. Jetmore, you want to talk about that, or you want me to talk about the kind of why we started allowing in Indiana the clinical diagnosis to be reported? There's roughly about a 40% false negative in these tests. So if you're tested and you test positive, they're pretty sure you have it. If you're tested and you test negative, chance that you're negative, but there's a real good chance that you're positive too. So, and I know at Reed, they had patients every day when we were in our conversations, they would tell us how many they have tested positive, but how many they were still treating as COVID patients. And it was quite remarkable.
78 out of 300? I mean, even if that's a 20%.
Well, but that's just started since last Friday, that they started reporting the clinically diagnosed. They're seeing about 40 patients a day at the respiratory clinic. I've asked them how many roughly did they think were met the criteria for that, and that's only at Reed. We're talking now all doctors, across Wayne County that can do this. So we've been kind of limited in what we're getting from, because testing was very limited. Doctors were just saying, listen, you're not going to qualify for a test, you're healthy, go home, convalesce at home, quarantine for 14 days. And we have been saying since the get-go, we need to catch this. We need to know what's out there in the community. So these total cases of 78, you have to understand we're behind knowing everything from March up to today, So since Monday, we got 14 clinically diagnosed on Monday, 18 on Tuesday, and 10 for yesterday. So anywhere between 10 to 18 more cases are coming in every day that are clinically diagnosed. Indiana has looked at the state and has opened up 20 new testing sites starting, I believe it's Monday, but I'm limited on my knowledge of it too. So I kind of just know what's being reported publicly on that. But that'll be at the Armory here in Richmond, and self-diagnosed, you can go there and get tested. You don't have to have insurance. You do have to have an appointment. There'll be a website that people will be able to go to. They'll log in, get an appointment. They can call and make an appointment. So with that, we're going to get a much better view of what truly is out there in our community. And that has been, I know what Dr. Jetmore and I and every other county has been squawking about from the get-go. If we're only testing the very sickest of the sick, how do we know what we have in our community?
Right, and if you're only getting 20% of those or 10% of them, I'm glad the testing, we're going to expand it, and hopefully it's much more reliable to give us an indication of when we can open up Wayne County.
Right. And I don't know how reliable the tests are. I haven't heard that we have a more reliable test other than that 40% still false negative, to where we're still looking at, if you meet the criteria, and I know with the chest x-ray and some blood work, they're able to confirm with better accuracy with that than with that test. They're presenting with a very what's the word I'm looking for? Everyone presents with the same look in their chest.
Looks like broken glass on the chest CT. It's very definitive.
Yeah, definitive look at their chest. So in that, I think that we've all agreed from the get-go, we have a lot more out there than what we're able to capture through testing. But I think that as testing increases, we're going to get a better look at that. But we also know are now we're far enough out that some of our first positives are being retested now to be cleared for work, to be cleared to go back to a nursing home, and they're still testing positive. Weeks later, so we're telling people to isolate, and after 7 days, after symptoms appear, and you're 72 hours symptom free. So you have to be at least 7 days past when your symptoms started and 3 days past any symptom at all. Then you can go back to work, you can go back out into the public. But these people are symptom free weeks later and are still testing positive. My question to the state yesterday was, are they shedding virus? And their answer is, I don't know. There's a lot unknown about this novel virus. We're learning every single day of, oops, we didn't know that. Oops, we didn't know that. So I think a cautious approach to opening back up is a prudent thing to do for Indiana. I think that we need to open things back up. I absolutely agree with that. How we do that safely is a conversation that needs to be happening. I'm glad that they got more testing. I think that was one of the big keys that we have to have in place before we even consider starting to open. So I'm a little nervous that tomorrow the stay-at-home order is over. And we still don't have widespread testing in our community. And I'm hoping that it's not going to be open the doors, but it might. I don't know what's going to happen tomorrow.
Okay, thank you very much for the update.
Okay.
That's very, very
Christine, this is Dr. Ryder.
Yeah.
The Chinese have released some information on this. What they're finding is that the elderly tend to have a positive PRC longer than everybody else, even out beyond 6 weeks post-recovery. But what does that mean? And no one really knows for sure.
Yeah.
We've also seen patients who tested negative and positive again. We don't know what that means. And they're asymptomatic at that time. So to your point, there's a lot we just don't know, but apparently the elderly are the ones who, in particular, can maintain a positive PCR for weeks beyond their illness. The other thing we might want to just mention in passing is the fact that the state is also doing more of an epidemiologic screen where they've just randomly picked citizens across the state to test. And I think they picked 20 or 25 in our area.
Yeah.
And some people have been notified to be tested on a random basis. Do you have any more details on that? I know that's happening.
It happened Tuesday. And there were 25 people that were selected. I don't know, they've not reported to me how many actually showed up, and I don't know the results of those. I don't know if they'll ever report those to us. I don't know what 25 people out of 67,000 tells you, but that was what Wayne County was allotted.
Only because
I think it's an epidemiologic study, just trying to get an idea of the incidence overall in the state.
Yeah, and only because I had a friend that was one of the 25. I know they had a survey. They did the antibody test that is currently available, and also the regular nose swab.
Okay. Yeah.
So they did both tests on those 25.
Well, I hope all 25 people showed up because it was important that they all did, so we got a good peek at what's going on randomly in our community. So I know Pete's friend showed up to it, but I don't know about the other 24.
Right.
Did I hit everything, Dr. Jetmore?
Yeah.
Okay.
Christine, you want to go ahead and get into the RN position and some of the other things coming up here in the next? The beat goes on, as Sonny and Cher would say, and time is marching forward to that June 1 date looming large in my mind. And we do have 2 RNs that Dr. Jetmore and I are going to do a phone interview with tomorrow, and try to do a better job of accurately representing what the
public health does and things like that. And then hopefully have an offer to be made by mid next week to the RNs after Dr. Jetmore and I talk to them. I'll probably bring them in on Monday and interview each one of them individually and go over a little more details as far as county benefits and things like that. And then hopefully extend an offer to someone by the midweek. So there's where we are there. I have got with Helmer, who we bought the vaccine storage equipment from, and told them that I need to schedule the delivery date of our equipment. We've made plans to have a temporary facility in the garage for the vaccine storage, and we'll work out of this room that we're in right now. We'll split it with some screens and make 2 temporary clinic rooms for vaccines in the meantime while the clinic is being built. We do have plans, and I believe I sent those to you, the plan that we decided to go with. It had a little bit bigger of a laboratory, and I felt a better flow for the laboratory was the only thing that made me pick A over B on that. So that's been sent back to the architects for final finishing work on that. I've sent them the sizes of all of the equipment that's going to go in the laboratory. So we should be going to bid as quickly as I can get it to be done. I've done everything that I can do to get this project going. But we're still looking at probably end of summer before we have the actual clinic finished. And so they have the generator ordered. They're laying the pad, the concrete pad for the generator next week. So we are moving forward with being able to get all of our vaccine over here for that June 1 transition. Any questions about where we're at, where we're going on that?
Have Steve or the commissioners give any sort of tentative timeline on starting and moving forward and finish date?
They think that they'll be able to award the contract by the end of July with all the legal things of legal notices and
bid process
and
all
the
that
bid
jazz.
process. They think that will be the soonest that they'll be able to award the project. And then Mr. Paust has assured me that he will push to have it a priority build and to have it as done as quickly as possible. But I'm still thinking end of summer before we'll have a clinic that we'll be able to utilize, but we're not going to let that stop us from doing clinics. We'll still have clinic hours here, and we're moving forward with our VaxCare trainings and our electronic medical records programming and everything like that. So we're still moving forward to be able to do public health June 1. We are doing case management for the COVID. The clinic still does case management for everything else that we're legally responsible to do. Childhood-led, any STDs and stuff. That kind of case management is still being handled by Carmi over at the clinic. But all COVID is handled here. And we have a volunteer nurse that comes in every single day and leads up the case management team. And since we have so many more cases coming in with that clinically diagnosed COVID, I brought on 3 other staff members to be doing. So we have 3 staff members and the volunteer all doing case management. Yesterday, the state announced that as of May 11th, that case management is going to be handled by ISDH and a third-party programming. But the state is hiring 500 case managers to do that contact tracing. So it'll still go into the NDS system. Counties will still know how many cases they have and be able to do what we need to do with that. but the state will handle contacting the patient. That patient, when they're diagnosed or confirmed with COVID, they'll get a text message and an email, just like your friend did, that they're to call the state and report to the state. If they don't call the state in 4 hours, the state workers will then track them down and get that case contact list and report, explain to them what their isolation and quarantine will be. The state will able to better identify facilities that are having problems. Right now, if Wayne County had a facility, let's call it X company, and they had a case, I would see one case at X company. But we may have a resident that's living in Howard or Henry County that's positive, and Randolph County may have 2 cases. And without us all checking in with each other every day, we would not know we have 4 cases in this one facility. The state will be able to better track that and contact that county and say, hey, X company's having a problem, send someone out there. And without us having to do case investigation, we will have employees that I can send out to work with companies of what's going on, how can we better help the stop of the spread inside facilities. And that's whether it's a food packing company or a plastics company or some of the other companies that we have here. We're here to help them put good policies in to not spread and to stop the spread.
Is now in the conference.
Ken. Hi, Ken.
Hi, Christine. Sorry, I was on a call with the governor's office.
Okay. So you're telling me he takes the priority over me? Ken Paust just joined us for the health board meeting, for those of you that can't hear that. So I think it's a good thing that the state's going to take over that. I think it'll be a little more uniformed across the state on what patients' information they're getting as far as quarantine and isolation and that kind of stuff. And they've assured us that it will be good communication between the state and the locals as far as what's going on. So I'm all for it.
Has there been anybody else in the county government offices that have helped us with the case administration or management?
I haven't needed it.
Haven't needed it
No,
yet.
I have not needed it, and I know that you had set up with probation that if we ever needed it, we just haven't gotten to that point, and that's because we had that volunteer that came in and really helped us out, so I do appreciate that.
Christine?
Yeah.
On the call, it was the governor's office. I heard you just say she was a volunteer. They did reaffirm today on this call that any expense we had for tracking, that we can get reimbursed on that if we track the time and everything.
Okay. Perfect. I might want to talk to you about that.
Okay, all right.
Does anyone have any other questions about contact tracing or the clinic and where we're at? Ken, I told them that you had told me that it's probably going to be end of July when we'll be ready to put a hammer to it and start building.
That's correct.
Okay.
Oh, I'm sorry, wait a minute, 1st of July.
Oh, okay, 1st of July.
Yeah, 1st of July. Right now, the tentative time schedule, if everything stays on schedule, we start construction the 1st of July.
Okay.
And would hope to be finished in 30 days and be finished by the end of July.
Oh, that thrills me to no end. So I'm going to hold you to that, Ken.
Well, I'll do my best.
All right. So can you guys all hear when people are talking on the phone? Okay. Does anyone else have any other comments about the clinic or questions that I need to answer about that? All right. The next thing do you want me to just keep going, Pete?
Keep on rolling.
So Saturday we are having a mask giveaway. We've had a donation of a lot of masks. I think we're up to over 1,200 homemade masks like the one I'm wearing to give out to the community. So we thought that this would be a great way to exercise some of our capacities and our capabilities when we're talking about emergency response. So we've worked with the EMA, Wayne County Sheriff's Department, and Richmond Police on conducting this drive-through clinic. So it will stretch or exercise our capabilities of having a drive-through clinic. And if this is a good place to have it, if it's going to be a bad place to have it. In doing all of this, I did find out that the fire department right across the street from us has a drive-through capability in their firehouse. So that will be something that I think that I will look into, that if we ever have the ability to do mass inoculations, setting up a drive-through, and that would be a wonderful thing for us to be able to do, because we'd still have access to our vaccine storage in this building and have a good drive flow to get people in and out of the drive-through there. The drive-through is scheduled for 10 a.m. to 1 p.m. I don't expect will last until 1 p.m. There's been a lot of talk about this on the radio, on Facebook. I believe the Palladium put something in about it. So we're hoping that people come out, get their mask, help us with exercising that capability and capacity of doing drive-throughs. And more than anything, this weekend, I want the number one thing for people in Wayne County to be talking about is masks. Should we wear them? Who should wear them? How many masks do I need to have? How often should they be washed? I want people talking all about masks. And the answer to that is you should wash your mask daily. You should probably have 2 masks so you could rotate through your mask. You should wear them anytime that you're out in public. I wear this mask for your protection, and I appreciate it when you're wearing a mask for my protection. I think Wayne County is doing a better job than the county that I live in. I don't want to call out the county that I live in, but there's a difference when I'm in a store in Wayne County and I'm in a store in the county that I'm from. I see about between 25 and 30% of people wearing masks in Wayne County, and the county that I'm from, it's less than 10% are wearing masks. And so I think that we're doing our public and our community is listening, and they want to do what's right. And the more that we're all wearing masks, the better we're going to be when we do open up. And I think wearing masks is one of the things that, if it's not required by the governor, I think that we should consider making that a requirement if you're going into a public building to have a mask on. It can be a homemade mask, it can be an N95, it can be a surgical mask like Pete has on, but some kind of face covering should be worn, in my opinion, when you're out in public.
You know, my thoughts on masks are, the one time that we have to violate that 6-foot distance that we want to keep from other people is when there's a financial transaction, when you're handing somebody a credit card or money. And that's, I would like to see employers provide for all their employees who are there at the cash register or at the takeout window a mask. I think that would protect them and protect the public.
Yeah. And I know you've been saying that since very early on, when you first even shut the lobbies down. You were talking about the employees needing to wear masks when they're doing that transaction at curbside. So I agree.
I
Okay.
think we've lost connection.
Who has?
John is blipping in and out, John Lebo. I'm not sure why.
We lost connection.
John, do you want to call in? Can you hear me?
There he is.
Okay.
The other group that was notified and is all on board is the fire department. I just don't want traffic to hinder
Yeah.
emergencies that could happen, whether it's medical or fire, and they're aware of what's going on and making adjustments on their end to cover. Okay.
Thank you. Yeah, they're, so far, I mean, it's been a good exercise so far. Communications hasn't broke down. You know, and all of you guys understand, you know.
You're now back on.
Okay. You know, I came here February 3rd and, you know, thought that the move was going to be the biggest thing that I was going to have to deal with, and along came COVID-19 and really threw us into a tailwind of being introduced to my EFS8 partners in this community in the midst of an unprecedented pandemic. And I can't say enough about this community. I mean, your EMA is a wonderful group to work with and have been very, very supportive of the health department, as every department that I've had to deal with has been incredibly supportive. So I really do appreciate that. But if any board members want to come through and just see what we're doing, you're more than welcome to. There's kind of two parking lots here to this building, the one closest to the building and then the one farther away from the building. We're going to do it in the parking lot that's farthest away from the building. So we'll be able to have two lanes of traffic going through the parking lot at any one time. And so stop by and see how we're doing, but I will give you an update on how it went at the next board meeting. The other thing that I've already talked with Ken about this. My question was office hours for the health department. Most county buildings or most county offices are 8 to 4:30. And the health department is 8 to 5. And when I asked why are we 8 to 5, it was because that's what the clinic was. And they didn't want the health department to have different office hours than the clinic. Since we're no longer associated with the clinic, I would like to go back to 8 to 4:30 with employees having a half an hour lunch. So we'll still be working a 40-hour work week. The state closes at 4 to 4:30, so if we need to have any corrections or assistance from the state, they're already closed. So that half an hour isn't going to stop us from doing the work that we already do. So I talked to Ken Paust and asked him if he would have any issues with the health department going back to the hours of 8 to 4:30, and he said it wouldn't be a problem with the county. So I'm just asking the board if you would have a problem if our hours went back to 8 to 4:30.
Yeah, this is Dr. Ritter. I move that we move our health department hours to be in compliance with the county.
All made the motion?
Second, Engelman.
John Engelman made the second. Any further discussion? Hearing none, we'll do a roll call vote. Jeff Butler?
Aye.
John Lebo?
Aye.
Bob Coddington?
Aye.
Paul Ryder?
Aye.
Sabrina Pennington?
Aye.
John Eagleman?
Aye.
And Pete Zaleski? Aye.
All right, thank you. I'll make that effective Monday.
Okay.
Thank you.
But we're not effective Monday, but we're still having the office closed in the midst of, in line with the other offices
Right.
of the county, correct?
Right,
Okay.
right. I guess I should tell you that I talked with Ken yesterday. There was a county staff meeting and talked about what it's going to look like when we open back up. And we'll open back up when the county opens back up, but we will, for the foreseeable future, always try to get people to do online and kind of break the habit of having to come in and doing in-person dealings. We'll have policies and procedures in place for our staff when we're out doing our inspections. You know, how the staff will stay safe in that. And they have a prototype of these plexiglass kind of windows that we'll set up, and I asked for the health department to have 2 of those set up, so there'll be a barrier between our staff and the public when they do come in. But I'm hoping that the county will have a policy county-wide, not just for county buildings, but if you're coming into our building, you need to have a face covering on for our protection.
That is accurate, Christine, and we're also asking that the public will have to provide their own mask.
Right.
Peter, this is John Lebo. Can you hear me?
We can hear you, John.
Okay, you're coming in now, so I'm missing out a lot. So I'll try to hang in there.
All right.
So that's all I had about that. Do you want to move on to old business?
Did you want to hit the SEP?
Oh, I missed that one. I'm sorry. Yeah, our SEP is up for renewal.
Syringe exchange program, just for
Okay.
viewing public.
All right. So the harm reduction program is up for renewal, and we're on the agenda for the May 6th commissioner meeting, and we will have a few people from ISDH that'll be on that phone call that will be able to provide any kind of supportive data and stuff like that that the commissioners may want through that renewal process. I have gotten an email from the prosecutor who wanted some more data. I'm in the process of giving him that data. Some of it's hard to do because our program by law is anonymous, and so getting out some of the hard numbers that he wants is difficult. But I'll give him everything that I can legally give him, and hopefully I told him in the email, I understand his reservations for having a harm reduction program in the county, but our needle exchange didn't come into play to provide. The reason we have a needle exchange is because this county needs a needle exchange. If they didn't need it, there wouldn't be one. So the needle exchange didn't cause the needle problem in the community. The problem in the community caused the need for a needle exchange. So if we all understand where we are in this wheel of life, we're all necessary. The prosecutor is necessary, and I understand how he looks at life through his lens of a prosecutor. But I hope the prosecutor can look at where public health has to look at a problem through a public health lens. And we're all on this wheel, but I'm just this spoke and he's this spoke. I support what a prosecutor does, and I would hope a prosecutor can support what public health does, because we're both necessary and we both provide good things for a community. But I'm hoping to set up a meeting with him and Dr. Jetmore, myself, Chris, who runs the program, and answer any of his questions and put his mind at ease of why we're here and what we're doing.
And Mike Shipman showed up at multiple of the public meetings, and I think just having the conversation and him being part of the conversation is a huge step, because I'm not sure that he was as part of the conversation even as much as you're talking about right now.
Oh, okay.
So I think that'll go a long way.
Okay. Any other questions about the SEP program? Okay. You want to go on?
We can go on. Attorney Bill, do you want to talk about that, Paul?
Yes. As you know, at the last meeting, our former attorney had submitted a bill for services, I think, basically starting December, January, largely February. of a total amount of about $6,000, of which we paid all but $2,677.50, which we disputed. At the last meeting, the board authorized John Lebo and I to meet with Rick to go over those disputed items, of which there were 22. And we did have a phone conference call with him early in the month and arrived and went over each of the 22 items separately. Found that there were 2 items that should have been exclusively billed to the clinic. One was actually a billing mistake, and that had to do with an item on forming their LLC. The other area that we found was a lengthy 2-hour meeting with basically just clinic personnel, no one from the health department involved. That was also assigned to the clinic. There were 4 items that he felt were largely dealt more with public health issues, and some of those issues were around liability insurance and the generator, and there were certain aspects of those 4 that he felt he basically had the public health hat on. There were other times on those same issues, the balance of the 22, where he felt that it was both. He also felt that from the beginning, when the transition committee was formed, and that was, I think, either November or December, that under the way it was operating at that time, Ron Cross was reviewing things for the county. He was reviewing what the transition committee was doing based for the clinic and the health department. And so some of those reviews were of transition committee records and minutes, and the vast majority of those were assigned 50-50. So the bottom line was, of that 2,677 that was in dispute, it came out that our responsibility would be 1,380, and the clinics would be 1,297.50. John, do you want to comment? And also,
Well, I'm trying to call in. Can you hear me?
We can hear you, John.
Okay, yeah, I've been listening. I'm in and out, so I didn't hear all of it. I know that we each one looked at everything. We then got together and we all agreed on the things that you submitted, Paul. Can you hear me?
Yes.
Okay. I can't really hear much. It's in and out for some reason. Just started doing that.
So I'm entertaining any questions that you might have.
This is Bob Coddington. First, thank you for the itemized bill and meeting with the clinic. This just shows you the dysfunctionality that's happened between, and I'm not going to speak on the history of it, but you need to for 5 minutes. My goodness gracious, to give a minutes to somebody, you have to give it to your attorney, to give it to their attorney, so somebody that's our employee, and then we get billed. Now, and I don't know if anybody sees that, talked about who owns the car and who gets the car. We're getting billed for that. I understand that's what it is deteriorated to. Nobody talked to Eric, nobody emailed Eric. We'll just go ahead. So I've got a proposal that I would like to recommend. Number one, that the auditor's office, before we pay this bill, gets the last 2 years of itemized bills, which they have not been getting itemized bills from the health department, my understanding, until Christine came. They would get a bill signed by Eric for $6,000. He'd sign it when we asked for it. I know during my term, and he'd say, it's in my office. If the State Board of Accounts want it, ask them to come look for it. So we never got an itemized bill to look. And that's history. But going forward, Christine, thank you for giving us all bills that are itemized, that every department from the sheriff's department always says, I've got an invoice here for an air conditioner. It's been received. I've signed off on it, and the auditor says it. Now, starting June 1st, we're not going to have an audit trail for the health department. So we need those itemized bills for the last 2 years, so when the State Board of Accounts wants to look at 1 or 2 of them, we'll have them at our access.
Because the State Board of Accounts looks 2 years back, is that correct, Bob?
It's a 2-year audit when they come.
So I think just as a cover for the county that we should have the last 2 years of itemized.
The last 2 years to cover ourselves going forward. Number 2, again, continue, Christine, as you have always done in every one of your previous jobs, give the bill for payment with an invoice. And number 3, I hope we can go forward that if the commissioners or council need something from the health department, we don't have to ask Ron Cross to talk to Christine, and Christine talk to Ron Cross, and Ron Cross talk to the if they need something, unless there's a dispute, just ask for it and get it. Ron doesn't like, making telephone calls and emails for this kind of stuff. I'm sure he wasn't. I haven't talked to him. So with those 3 things, I would reluctantly agree to pay this $1,380 bill.
Can I hear you?
I work in the direction of the board,
hearing Bob, but what's the intent of doing that?
Of doing what?
Okay.
Of getting the itemized?
Well, I think itemized, the attorneys have always submitted itemized billing for their time.
But they have,
Mom, can you turn it down a little?
but the auditor's office
So
doesn't.
I don't know that that's something that's not been done.
I got it.
Right, correct.
I don't know if they can hear us.
We can hear you.
So basically, all it is, it's an internal thing moving forward that Christine has already done, so there's no change. The attorneys have always given us an itemized bill, but they've given it to the health department, and the health department would say, pay the attorney, whoever it is, $3,200 plus my signature.
Hey,
with no
can you hear me? This is John Lee. I've been,
No. So I think the concern,
This is Ron
Paul,
Cross. I could not hear Bob's comments, so I'm not sure exactly what he was proposing.
It's not just you. Everybody said.
Pardon?
Ask them again if they can hear you.
can you hear me? This is John Lee.
yeah, we got you, John.
I haven't heard anything that just went on.
There's a very bad connection.
Okay.
Do you want me to give them this phone number to call in? John, can you hear me?
I can hear you.
Okay, do you want to call in on the landline and I can transfer you into the conference on the phone like John Engelman's on?
It seems to me they're 2 separate issues. Is your point, Bob, that you want the county to see the itemized bills that the health department got?
All I want them to see is to put it with the invoice. Ron Cross has no idea what we do after they send us an invoice, other than he gets paid. This is an internal thing that Christine is doing that hasn't been done internally because it's been held by the health department. She will have a copy of that invoice. But for audit purposes, when the state comes in and says, I want to see a November bill in 2018 from this, you hand it to them. We say, sorry, you've got to go across the street to get it.
I fail to see the problem that we're trying to correct.
Right.
But this is an internal problem, Ron. You guys have done everything correct.
An internal problem for whom?
For the health department to the auditor.
Just listen.
Has that been a problem?
It has been a problem.
And
In
the
what
concern,
respect?
and the concern is when state board comes in and audits the county, they're not auditing the clinic, they're auditing Wayne County. And when the State Board of Accounts comes in and audits Wayne County this year, they're going to audit 2018. When they come in next year, they're going to audit 2019.
You need to tell me.
I can't hear anything Bob says, but what is the time period he's concerned about?
The last 2 years that the State Board of Accounts would be coming in to audit the county.
Well, I'm assuming, and I've seen several claims in prior years, that usually those claims are signed off on by either Dr. Coulter or by the prior health officer.
Without any detail, though.
That just means they're the ones that are on the hook for it. Because they are certifying when they sign off on the claim that the services have been provided and are due and owing. And
Can he hear John Lebo or not?
Yes, we can hear John.
He cannot hear. This is it's all garbled, and he needs to be able to talk to you.
Okay, if he could call into the health department at 765, what's our phone number? 973-9245. Hold on a minute. Here's our phone number right now. What's our phone number? I was right.
Okay.
I was right. Let the record stand, I was right. John, can you hear me now? Call the main line. We can hear you. Does anyone have a way to call him and tell him to hang up and how to call into the conference line? Mr. Lebo, can you hear me now? Then he'll press 7, and the passcode is this.
I sent John a message to call in. I think
Well, this is Dr. Ryan. I think we're talking about two separate issues. It appears to me that what your concern is where the separation between services for the clinic and the health department, you wanted those segregated, but the health department and the clinic were one and the same before January 1st.
John Lebo.
From a auditing point of view. If there was any separation in auditing, it would have been actually after January 1st, and that's been done, and we have that information.
Kim, do you have the itemized invoices from the health department, from the clinic for 2018 and 2019?
No, I do not. I just get the end page of the invoice that shows the total hours worked and how much is due.
So going forward, Dr. Ryder, what they would do is when the State Board of Accounts, and we'd send them, oh, go over to the clinic, they're holding it. Well, they're not part of us anymore. I don't know what they're holding after June 1st. We're asking for audit purposes going forward for 18 and 19, just to have those invoices that, Ron, can you hear me now? Ron,
Yes.
Yes. You guys have done everything correct. You give an itemized invoice to the health department. Eric,
But we're only talking for the period January through May 31, is that correct?
no. We have not been audited for 18 or 19, is that correct, Kim?
Kim, don't we have an audit going underway now?
No, that's not correct. We've been audited for 18.
We haven't been audited for
Yes.
19.
There's an audit for 19 going on right now.
So we just need a copy of the invoices before June 30th, the itemized invoices. Now, I don't want to have to go to your office because I can't get them from an employee of Wayne County government.
So if we're just needing itemized from January
19.
Oh, I don't have those yet. I thought you meant for 20.
No, it looks like what he's suggesting, he needs the audit, he wants it from the previous 2 years, is that correct? 18 and 19.
Yes.
So what you're saying is, I assume it's not just doing legal services. What you would like is all the invoices from the health department during that period of time before the audit?
Kim, what do you need? Is that the only issue that we have as far as the itemization?
As far as itemization goes, that's the only one I have been kind of sort of dinged from State Board of Accounts not having detailed records for it.
Okay. So Kim, what you've been dinged because you did not have the itemized legal bills from the health department. Is that correct?
That is correct. And since they know the situation, they would go to the health center and they would be able to see it there at the health center. But legally, I'm supposed to have it on record.
Then I move as a health department that we provide that information to Kim Walton.
And yes.
But we don't have it, the clinic has it, but I think as a contingent.
Well, it's still health department records, even though we'll have to obtain it from people who are now working for the clinic. Some are still working part-time for us. But I think we need to provide that. So which means they need to provide that to us.
Okay.
Don't disagree. I think Bob's point is the concern of we don't have any motivation except this bill in front of us to really make that happen.
I still don't think we voted that bill.
And I'm not sure, to be honest with you.
Well, I'm not sure how failing to pay the attorney will speed that up.
They should.
Kim, are you talking about billings for the health center as well as the public health?
Yes, for the health center and for yes, for health center, but no, public health, Christine's been turning in everything. And then anything from the health center or HRSA, I usually only get the last page of the statement.
And that's where you've been deemed. It's in those records, is that correct?
That is correct.
Well, we continue to have problems with that. I mean, there's witness the...
And that is correct, and State Board of Accounts knows the situation, unfortunately, and they've been willing to work with me as much as they can, but, you know, legally, I'm not doing my job to the full extent because they don't have all the paperwork.
Well, I know we had a $60,000 claim that I suggested be denied, but it appeared to be a retainer and advance payment for services, which the State Board of Accounts does not permit. Did that somehow get paid?
I am not sure what happened on that. I know I gave clear instructions to my bookkeeper not to pay that, and I watched her move it from the date of service that I spoke to you and the commissioners, and apparently it did get paid. I'm not sure what happened there.
I have no idea.
Well, again, Dr. Wright, this appears to be somewhat of a separate issue and a problem that I don't know that we can totally even resolve today, except I think we probably need a more detailed request from Kim on exactly what she needs for her audit.
Okay.
And I think certainly from our point of view, we would cooperate as to the best of our ability to do so.
Simply put, Kim's position is that as far as the State Board of Accounts is concerned, and they view her performance as the county auditor, they do not differentiate the manner in which she handles HRSA funds versus the way she handles other public funds. And it's very clear that you have to have an daily itemized statement for services to pass State Board of Accounts muster. If in fact you're billing for services. And she's saying that she's never had that from the health center. So I would assume that will be something that will be addressed. It was addressed in 2018, and presumably that's behind us, but will be addressed again in 2019's audit.
That's correct.
That's correct.
I think there are other remedies that might need to be discussed outside the purview of this board for that particular problem.
Well, that's not going to be a reoccurring problem after June 1.
Right, because
And really isn't a problem.
it's not a problem going forward because Christine has done it correctly since the day she got the first invoice.
I couldn't hear you, Bob. You broke up.
Christine has done it correctly for the invoices for 2020 and going forward. It will not be.
Unless there's a change in the structure going forward, you should not be receiving legal bills unless it's separately retained counsel or work that is extraordinary that our firm would have to do, because the way it's working now, the commissioners increased the amount of our firm's retainer contract for general representation of county government to cover an allowance that includes services to the health center. So, and I think, Christine, correct me if I'm wrong, I think you still have a $20,000 line item or thereabouts in your budget, and I'm not aware that council's going to pull that from you, but I'm not seeing your final budget. I know that's been a problem.
I don't think I've seen my final budget.
I have every confidence going forward that the auditor's office will get the documentation they need to pay the bills and pass State Board of Accounts audit.
And I'm going to make Dr. Wright, I'm going to make the point that we actually have those itemized items in front of us now from at least December on.
Correct.
And there's still an area of dispute on paying the bill, which I think is actually a separate issue from the other issue.
It is.
I would move that we go on and pay what the committee that you selected recommends that we pay, and that the clinic pay what their share.
There's a motion on the table. Is there a second?
Second.
That was Sabrina. Any further comment? My concern is that these bills really aren't the public health, and the taxpayers are going to be burdened with them, but I also understand that we've looked at these for, 2 months or 3 or 4 board meetings, and we need to just move on and get to what's more important business than, so.
I don't disagree that Mr. Boston needs paid. I'm sure he did good work, but it was for the clinic, not the public health department. It's been my stance from the get-go that as of February 3rd, I was the one that allowed people to talk to attorneys on behalf of public health, and I wasn't involved in any of those conversations. And when someone wears 2 hats, it's hard to differentiate and bill when you're representing both. My first meeting with Mr. Boston, I brought up that I felt like he was strongly favoring the clinic's interest over the health department's interest. And when I'm looking at these, again, I'll pay whatever I think is fair, and I did. And that was the majority of it. And what was left, I feel like, was incurred by the clinic for the clinic and billed to the public health department because we won't do anything about it. I continue to pay 70% of all their immunizations that come in, but I won't be able to be told how many of those shots are public health employees or public health clinics, clients. But when I ask how many people are coming in, they say no one's coming in for public health, but I'm still paying 70% of all of their medication that goes in there without any documentation given to me, and I pay it, and I pay it. And I pay it. This is the one thing that I'm able to say, I don't want to pay this. I don't think that it's fair that the public has to pay this bill.
We have a motion.
Okay. Any other comment? I'm going to do a roll call vote. Jeff Butler.
Aye.
John Lebo.
Aye.
Bob Coddington.
No.
Paul Ryder.
Aye.
Sabrina Pennington.
Aye.
John Eagleman.
Abstain.
Pete Zaleski. No. Pass 4-2 with 1 abstention. At least gets us behind us.
Yep.
Let's see. And maybe on the vaccinations, that's something that you send to the board and then that we all take a look at a future meeting, at the next meeting. Fee ordinance, I'm gonna let Christine.
Okay.
And I may pop up some information on the screens in front of you to try to follow along, so we have that.
And I only bring the ordinance up because, you know, COVID-19 has been on all of it, or, you know, the main thing, but there are other things that we have to keep going on. This ordinance, I thought, was something that we should move forward on. I had given you guys examples of other ones, the food ordinance and the septic ordinance that were kind of put behind, but I did feel like we were safe to move forward on the fee ordinance. I sent you the old ordinance in an email so you can see where the changes are happening. I've added a definition for vending machines and micro markets and bed and breakfast. I added the bed and breakfast into this ordinance even though our food ordinance doesn't have bed and breakfast in it. That way when we do a food ordinance and add bed and breakfast to it, we don't have to change this fee ordinance. It's already encompassing the bed and breakfast, which is part of the new food code, has a definition for bed and breakfast, so I added that in there. And then also, if you scroll down, there is a definition for commercial on-site sewage systems. That's something that's not in the other fee ordinances. So then as you go down, the first change in there is the change to our vending machine permits. In the old ordinance, vending machines were charged the same as a retail food establishment at $250 would be what each site that had vending machines were charged. There was a law that was put before legislator in the last session to deal with what people saw as overreaching of health departments for fees for establishments for vending machines. And so it failed, did not pass, but they did ask us to look at our fees and see if they were excessive. Looking at our fees, I felt like $250 for a vending machine was excessive. So I reduced it down to what we felt like was a reasonable fee at $250 or $25 per machine.
How many annual inspections do we do on a base food establishment, say at $250 versus just a vending machine?
Let me go get a food inspector. I believe that they're doing at least one inspection a year. Let me grab Angela. Angela, can you come in and talk about the vending or the inspections? Or I didn't know Craig was here. I got Craig. Why don't you get Craig? Craig's the most senior food inspector, and I'll have him talk a little bit. Like I said, I came in on February here, so, and then COVID took over, so I'm still not the expert on you know, what goes on as far as inspections and how many times a year each establishment is inspected. So this is Craig Markley. We're talking about the fee ordinance, precisely about the vending machine provision to change that to $25 per machine. The question was, how many times a year do we inspect vending machines versus a retail food establishment?
It's the same amount. It would be, well, C requires twice a year.
So.
And the time involved on a vending machine versus a base level retail food establishment. I mean, I would assume you have quite a bit less time involved in the vending machine.
Yes, less time. Yeah, with the exception of a couple of places, but yeah, Sugar Creek is huge. And it's all different levels, different floors. They have so many break rooms at that facility.
But we're also talking multiple vending machines, so that would be multiple fees.
Yes.
Okay.
Yes.
I looked at a couple of other county fee ordinances and how they did them. We could do a few different things. In Wayne County, they do per site.
Yes.
So each like factory, if they have vending machines, they're assessed the $250. Here, it would be based on how many machines are at the site.
Correct.
Or we could do, I kind of like how Allen County did them, where each company that houses the vending machines. So Canteen is one of them. And let's say that they had 50 machines in Wayne County. We would have a progressive fee for those that, if they have 1 to 50 machines in this county, they would be assessed this amount of money. If they have 51 to 151, it would be it'd be tiered in that. So we could look at that, or we could keep it with this 25 per machine. Whatever way we're going, they're getting a break.
Okay. Is there any site that has over 10 vending machines?
Is there what?
No.
Okay.
I'm sorry, what was the question?
Was there any site that had over 10 vending machines? Because I was thinking if Sugar Creek is paying $250 for the whole, and then it's $25 per, if they had 20 machines, we could still cap the machine per address if we needed to.
Yeah. And Sugar Creek isn't assessed that fee.
Correct. It's the company who owns the vending machines.
Oh, okay. Okay. But they're going to pass it on, whatever it is.
Yeah. So, and to understand, these vending machines are only ones that have potential hazardous foods. So if it's a vending machine that just has potato chips and candy bars, it's no fee. It's only ones that we would have any kind of interest in, and that would be some that are refrigerated that have potentially hazardous foods. So think of a machine that has sandwiches and things like that.
No pop machines or anything like that. Just
So it's only, and then a micro market is on here, and there's a definition of a micro market. Those are kind of emerging things that are coming out into factories and things like this, where it's a little bit more than a vending machine, less than a cafeteria.
It's like a small self-pay convenience store.
Yeah. So we did make a micro market permit of $50 because they are a step up from a vending machine, but still not a retail food establishment. And I think that when you look at whichever way we go, $25 a machine or this tiered approach, I think that that's going to meet the requirement of what the legislator asked us to do. Every county, look at your fees, and you decide, is it excessive? Don't make us do it. And so I think that we are able to meet that threshold, no matter which way you guys choose to go with that.
I think having a set fee per instead of tiering it is going to be easier on the billing side.
I agree.
Anybody have any comments so far?
Ron Crosby, when this goes across the street to the commissioners, it needs to go with the representation made by this board that the suggested fees are not in excess of the actual cost of delivering the services, because that is a statutory requirement. Right. So while I realize there's a lot of subjectivity in establishing the fees, there is that discrete legal limit that's set out in the statute. So I'm not going to suggest on what basis you make that finding, but I think that needs to accompany the ordinance that you send across to the commissioners.
I would think that if we're doing 2 inspections a year, and even on a vending machine, you're going to have the drive out, the drive back, and the time there, just on an hourly basis, $25 would probably not even cover the hourly wage costs. So I don't think there would be any concern with that. I mean, unless you have a different opinion, Ron.
No, I'm just making that comment.
Okay.
There needs to be that determination made. On what basis you make that finding and determination is up to the discretion of this board.
Correct.
And I was going to send this over to you, Ron, to review before we send it to the commissioners for review. So when we take it to them, you can say, I've looked at it, I don't see anything glaring legality-wise that there's a problem with this, so.
I don't see anything that's jaw dropping either, so I'm not worried about it.
Okay. So then everything else is the same. The fees for your retail establishments, nothing has changed in this, other than we did add for bed and breakfast establishments, and right now we're not doing anything with them because by ordinance, it's not in your ordinance. Although you have how many establishments?
We have 5. I've been doing inspections or visits with them, but there's been no fee involved.
So if we pass a food ordinance, there will be a definition and our ability to get a permit for them in a new food code. Right now, it's more just a courtesy that we're working with them, and it's a courtesy that they allow us to go in there and work with them. But if we do, we felt like 150 is somewhere between, it was more like we priced it for a mobile unit. Because they are not in service every day, and it is a little different than a retail food establishment as far as the requirements and things go. So it's a step down from the fees of a retail food establishment. But it still takes time for county employees to do those inspections. Then you go down to your residential sewage disposal. The only change in residential is your indemnity bond was very low. It would not have covered any kind of failure of a contractor if they messed a site up. I think you had it at $5,000. A septic system, if it's a sand line system or an elevated system, is more toward $20,000. And so we want their bond to cover any liability to a site that they would need to have. So I think it should be up at $20,000. I then added commercial on-site sewage systems in here to be able to permit those. Before anyone gets really excited about this, because I do agree, I do not want to take jurisdiction over commercial sites. That is an ISDH responsibility, and they are the ones that need to do all plan reviews and everything for that. However, once they give that approval, it does flip to the county to make sure that these are being installed correctly. If the county doesn't require a construction permit, then there is no basis for us to go out there and make sure that what they were permitted to do or approved to do gets done. So if ISDH goes to the trouble of requiring a flood dose system or an elevated system, and they choose to put in a gravity system, there's nowhere without us issuing that permit and going out and making sure that what was allowed got permitted or got installed, then they can put whatever they want in there. So, and we can charge the same fees as what we do for residential. There was a question, someone asked, why don't we charge more for commercial than we are doing for residential? It's my opinion that your fees are at the highest in the state already for on-sites. And I don't want to just go out and charge more just because we can charge more for commercial than we do residential. Our workload is lower on commercial because, again, I am not going to do ISDH's work. They're going to still do the approval, the plan review, the soils, and all of that. But once they give the approval, then we will make sure what they approve gets installed.
This, Dr. Ryder, so what you're basically saying is that on commercial, we're basically checking to make sure they're in compliance with what the state approved them for.
Yes,
So I take it you have access to the state-approved plans so that you can determine compliance, is that correct?
yes. And if at any time when we go out there, if there's an issue, then we call the state in for it. But if there was ever a failure or a problem with a commercial site, it is still the county's responsibility to write orders and require correction of any on-site. So I think that it's important that we're part of that construction of an on-site system so we can verify what the state approved is actually going in.
I strongly agree with Christine. This is an area where I believe the health department's been derelict in the past.
If we're on the high side of the residential, do we need to review those to be lowered? I mean, are we?
We haven't had any complaints about that, but we are on the high side.
But, just Dr. Ryder, but we're not violating the state statute that says we can't charge more than our cost.
I definitely think that we are, we're covering our cost of how much work goes into on-sites. I don't think anyone understands how much county time goes in to properly plan review and proper inspections of on-site systems.
Okay, so we're not violating the state statute that says we cannot exceed our cost.
No, no.
Okay.
Are you ready for a motion?
I can, there's a couple other changes I just want to let you know. When you then go down to vital records, there is an increase on your birth certificates. Death certificates stayed the same. We were not charging for copies of paternity affidavits or the notary services. And I checked for the legality of charging for both of those, and we're within our rights to charge for those. For birth certificates and death certificates, you guys had an odd policy written into your fee ordinance that for additional copies, you gave a reduction of cost. So like if I wanted 2 copies of my birth certificate under your old fee ordinance, I'd pay $10 for the first one and $4 for the second one. I don't know why you did that. I called around, or I actually had Angie, one of your registrars, call around. No other county is doing that. I had never heard of anyone doing that, so I would suggest you stop doing that for birth certificates and death certificates. Our bringing up the birth certificate to $15 and keeping a death certificate at $15, we're kind of right in that sweet spot of areas around us. We're not the lowest and we're not the highest. We're just kind of right in there. So we would be at the lower end of the highest too. So, or the, yeah. Most people are a lot higher than what we are. So, and then I also took out, you had something where you gave away free birth certificates for kindergarten roundup. And I took that out. There's no legal reason for us to do that. And we should be charging for our services.
Before we entertain a motion, the very last line has an effective date. Do we need to include an effective date on a motion if we're to entertain a motion today?
No.
I understand anything that we do still requires commissioner approval.
Well, the ordinance itself has to be approved by the commissioners. I think what will go forward is that suggested ordinance with the recommendation from this Board of Health that the commissioners adopted, and again with the finding that it's compliant with the statutory limitation of not exceeding actual cost. I don't, unless you want a separate ordinance that would be signed by the health department, I don't know that that's necessary, Christine. I don't know what they've done in the past.
Yeah, sometimes I see effective dates 30 days after adoption to give people a chance to make
All right.
adjustments, but your old ordinance said exactly that, and so I didn't change that.
Yeah, I think it'll become effective the day the commissioners adopt it,
Okay.
which I would expect if you have it, if you approve it today, then they'll deal with it next Wednesday.
Okay.
Now, this is Dr. Ryder, I approve, I make a motion that we approve this ordinance to be forwarded to the Board of County Commissioners.
This is Jeff Butler, I second.
Dr. Ryder made the motion. Jeff Butler seconded. Any further comment? Hearing none, we'll make the roll call vote. Jeff Butler?
Aye.
John Lebo?
Aye.
Bob Coddington?
Aye.
Paul Ryder?
Aye.
Sabrina Pennington?
Aye.
John Eagleman?
Aye.
Peter Zaleski? Aye.
I have some things.
Okay. And one other piece for Christine?
Yes, so under new business, I would like to introduce the board to Jan Breckstrand. This is Jan.
Hi.
She has been the RN volunteer for us, and I'm telling you, I have no idea where this county would be without Jan. She stepped in, offered her services. I didn't look for her, she looked for us, and asked what could she do for the county. So one of my favorite quotes in the whole entire world was when John Kennedy asked, ask not what your country can do for you, but what you can do for your country. And Jan epitomized all of that. She asked what she could do, and I said, boy, I need someone to head up, because we don't have an RN right now, all the case management. She selflessly comes in here every single day. Jan, what time did you leave last night?
8 o'clock.
8 o'clock. She stays and makes all of these connections. She is the one that has trained the rest of our staff to do all of this stuff. So I would like to award her the County Hero of the Year for 2020 for everything that you've done for our community. So,
Thank you.
and just a small gift.
Oh, thank you.
It's got some hand sanitizer in there for you.
So chocolate, darn it.
But I know the board, everyone on the board, this is the Board of Health here. We've got 2 members on the phone and everything. Appreciate everything that you've done for us. And the whole entire staff just adores
thank
you.
you.
We all love you.
Good.
We're happy when you come in.
Hope things get better
Thanks a lot,
soon.
Jan.
Thank you.
Thank you.
Bye. Thank you, Christine.
You're welcome, thank you. So, I can't say enough about her. I've never, in all of my years in public health, seen someone so dedicated to volunteering to put us through this. So I hope that the board appreciates everything that she's done.
Christine, what is her name again?
Her name is Jan Breckstrand. 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 I might be saying it wrong. I just call her Jan. But she does every single day she comes in.
Awesome.
So that is everything that I have.
Anything else from anyone else?
Just need to set the next meeting.
Yep.
Are we 2 weeks?
I think so.
That the 14th?
It'll be May 14th.
Any issues with having it here with another Zoom meeting and the ability to call in on the conference line?
That seemed pretty agreeable to everybody?
Yes.
I agree.
Yep.
I agree.
All right.
Very good.
I agree.
The same link that you used today will be able to be used on May 14th. All the same codes will work.
Okay. Okay, same telephone connection?
Same telephone
Yep.
number, exactly.
The exact same thing. Don't give that
And the same
passcode
codes will
out.
work too,
They
Pete?
didn't see what the password is.
I was
Okay,
able to use both today, so I'm glad.
entertain a motion for adjournment.
Dr. Ryder, so moved.
You go down, leave both second.
Motion and second, and we are adjourned. Thank you, everybody.